I film for you?
Hi, my name is Gengis. I'm a research nurse in Montreal, and crystal meth is a big problem here in our city.
I was going to introduce you, but hello.
And,
We have a problem in the city, do we?
we do a lot of our
What city are we in first?
We're in Montreal,
We're in
Canada.
Montreal.
It's like just north of United States.
Where all the crystal meth
and
comes from.
south of
probably.
Puna.
And we've got a room full of giggly people who have just spent the last 3 days being very activista, trying to support our communities. And yeah, people disagree. As every city I go to, they say, oh yeah, chemsex is not a problem here, it's not a problem here.
We have a public issue here.
Tell me about it.
Talking about it, like a lot of my patients are like, they take time, but they start talking about it. We've just talked about, they're losing their jobs, they're losing their apartments, they lose their couples, they just lose everything, and when they lose weight,
They died.
Yeah.
they die. Yes.
You mentioned that some people are not adhering to their PrEP.
One of my patients just died last Friday. So, and was a crystal meth user, and people are getting HIV positive on crystal meth when they're using it like intravenously talking. So yeah, we should like ring a big alarm to our Ministry of Health here.
Well, we were there, weren't we, Go? So we were just at the Ministry of Health. Pierre?
For sure, it's a big problem, and the problem is present for many years. But people they feel ashamed to discuss about that. So you have to be proactive.
As you have been, Dan.
Yeah.
What building am I in? Tell us about this building.
We're at the Clinique de médecine urbaine du Quartier Latin. We're the biggest HIV clinic in Canada right now. I think we're the biggest one, and we're following a lot of men who are having sex with men. So we know there's maybe underlying the condition. There's like probably like psychological issues. There probably are social issues and self-esteem issues. So we should dig the problem and give proper services to all our community that is slowly dying.
Oh, he's an activist. You were explaining to me before, you're a researcher, but an activist researcher. You were explaining to me before, a DJ, about working with DJ to accomplish things.
Yes, I'm referring people to group support, which they can freely talk about their, we shouldn't say addiction, but their crystal meth using and how they use it, why they're using it, and maybe this part of time we don't have that this time to discuss about it in like medical appointments. So I think like those group support should be like more of them, and a lot of like imply a lot of people that could be like sexologists, psychologists, and a lot of physicians. We should volunteer. Dr. Cote and we should volunteer in this.
Peer worker also.
Yeah.
It's really important.
Tell us about peer work, because, okay, we were just at the public health offices where, you know the Denver Principles. Have you heard of the Denver Principles?
Then
Denver Principles.
Yeah.
Where it's about, we're not going to provide any HIV care since the epidemic unless it involves people who are living with HIV. It was a discipline that was created I don't know how long ago, but it was when HIV care was starting to, and activism was in its youth. They were saying, we get together and we promise that all of the HIV care in the world, if we can, is going to involve the opinions and methods and experiences of people living with HIV. And in regard to chemsex, it has to be the same. You want to provide chemsex support in this really gorgeous building with your gorgeous people. You've got to engage with peer workers and people who understand and have lived experiences of chemsex. Is that a challenge for an organization like this?
It's comment on pourrait dire un défi? Un défi?
It's a challenge.
It's a challenge. It's a
Can you
new
beat it?
it's a new challenge, and this problem have been underlying for the last decade, and now and now people like some of them are they need like emergency help right now. So
Okay.
yeah,
Emergency help.
emergency help. When you got like a condo or family, you got a big job, and your life is doing fine, and you lose everything in less than a year. Yes, there's an emergency.
There is a pretty fast trajectory from first using meth to chaos. Really, you see that trajectory.
I've been working in HIV for the last 3 years only. So, but I'm seeing like to a lot of people that this transition is really short. Oftenly when they switch from smoking to injections.
Yep. Keep going.
Well, when they do switch to injections, like it goes really fast. It goes really fast.
I've been surprised that you are talking about the 6 year period of using. I think it's more
Quicker
fast,
than that.
Yeah.
So you're thinking
It's
that
faster.
what do you see in regard to the trajectory when someone first discloses that they're using chemsex?
I would say in 1-2 years they crash.
Okay, just can you timetable the 2 years? What's the first sign, second sign, 10th sign?
I can do. I have a big example. I have one of my patients is really brilliant. He has a lot of education. Came in my office at when I was following him since the beginning of his infection, and he was having no side. He was saying that he was taking no drugs, and one appointment there was like injections. He told me that he got blood work done, but there was no blood work done. It was injection. One of the vein just like was all entirely burned, and then losing before he lost his job, he tried to have stop working papers and ask us like, can you stop me working? I cannot go work, and he never told, and then lose his job, and then told us everything. Lose his job, lose his condo, lose his family, lost his children, his husband, and everything. So actually it's really sad from us because I've been following him since I'm here, and those things that I was supposed to see, I never saw them, and I wasn't able to do anything.
That's good of you to say. Don't take responsibility. It's
No,
very hard.
no.
You're working
Yes,
with a very
but it's really
complicated
hard,
mental
though.
health problem.
Yeah.
You know, the self-destruction and the complicated reasons that people use chems, and they're dealing with such a complicated drug. It's lovely that you say you missed things, but please don't feel responsible. It's
No, but if we were having the tools though,
okay.
to the underlying conditions, like proper questionnaires and maybe more time.
You see it's too, which is very, very interesting.
I think
Yes.
one of the reason also why it's maybe faster here, it's because here talking about drugs, it's taboo. We cannot talk about drugs. People are scared to talk about drugs. So it's before they start talking about it, it's a problem. So that's why maybe it goes faster. Okay. And also, I had a friend of mine that used to be in London and came to Canada and used to do crystal meth recreationally in London and use recreationally here, and say also the crystal meth here is way stronger than in London.
Okay.
That's from one person, so I don't know how effective it is, but that was its reality.
The one reality I know is that when I travel, there are 3 stages of the journeys that I go on. The one is meeting a certain group of people who say, it's not happening here, it's not happening here, you're welcome here, but it's not really happening. And now the group of people who say, we're seeing some signs of it, we need to pay attention to this. And then I see another group of people that go, wow, help us, we need to do this. Usually that last group is the gay community group. It's usually when I go to a gay cinema, or go to a gay pride event and meet gay communities. It's usually them that say, help us, it's happening so big. It's not so often. So it's a very good sign that I'm in a centre of excellence where gay men like to come and feel very confident to come, where gay sex is discussed very easily, to hear you are on top of this. I mean, you clearly you want to improve the work you do, but you're aware of it and you care.
I do care. This is my community.
Oh, yeah.
Yes, we're living in this community when we're working in. So
We care.
We do care.
Thank you for caring so much. I've loved being here. I think you're all amazing. I thank you for being so kind and empathic about these issues.
Thank you.
Thank you.
Thank you.
Thank you.
That was fabulous. My arm hurts.